Welcome home. We are WNST, AM 1570, Towson, Baltimore. We are Baltimore positive, positively getting us in through 27 years of all of this stuff. And we got football season and we're getting baseball playoffs getting ready to go as well. We have done a partnership here with GBMC, and I'm so proud of it because they're right down the road. My radio station's been here in Towson all these years, our 27th anniversary, and as part of that, not just the injury report we do with Luke, but really trying to educate ourselves about all sorts of things. So much so, and I know any doctor, including even someone that specializes in perinatal care and obstetrics. I want to make sure obstetrician and gynecology can even appreciate that I made my colonoscopy appointment. So I just want to congratulate myself this week on behalf of my GBMC healthcare partnership as we welcome in Dr. Aneesha Varrey. See, week to week, now this is not one this week that's going to apply to me, Doc, but it could apply to women in my life, not my wife, because we're not making any babies. But thank God there are people making babies and folks like you are there to help them. Good day to you, Doc. Great to have you on.
It's my pleasure to be here. Thank you for inviting me.
Well, I for years and years, and I had a friend many years ago who was a nurse at GBMC, and I've known all of my life about preemie babies. My stepbrother was born very small. My son had relative normal, but I see folks who struggle with this, and I've always known about the special care at GBMC. I think maybe a lifetime of living here and being a Baltimore County resident voter, business. You just know about this and you hope that no one you know needs that. Normal births, you do all of that, and healthy babies, you do everything over there. And I'm sure you've seen it all, but I have so many questions, and I guess just coming at it is sort of a famous hospital for making babies, right?
That is true. And delivering them and taking care of moms. Yes.
Well, what does that entail in the modern era that when I see someone, and I have lately, I see as many of the blue and pink balloons when they're making the babies, but then immediately I start seeing sonograms.
Mhm.
The beauty of birth in the modern era is incredible on social media. And I think just how much information people can share and how much science has come a long way to let people have better pregnancies, better births, better experiences, and make healthier children, right?
Yeah, exactly. Yes. I think it is advanced a lot. So there is a lot of good in all the information that the women have now when they come to me. I love that they have their TikToks and Instagrams and they have their social, there are a lot of doctors also on social media who give out a lot of information, a lot of nurses, doulas. And so when women are coming to their appointments, they're very well equipped with a lot of information. Like they're like, I read about this or I watched a video about this. So that's really nice. But everything has a good and bad. And so the good information is great, but then the bad information, I'm also having to like spend more time fending off saying, well, no, don't do this. That's not medically good for the baby and the pregnancy. But I think it's really good because when a woman is, even if there are all kinds of women in different places in the world, and with social media, they're able to get all this information even if they don't have immediate people around them to give them this information. So it's really good as a conversation starter with the doctors to be like, I heard this or I watched this video. And yeah, the ultrasounds are just they have gone through a huge transformation. I'm sure when you had your kids, you were like probably got one or two ultrasounds. Now, moms are coming and they really want 3D ultrasounds. You can really see the pictures of the baby. And then it's a really fun thing to kind of for us, get the right picture on ultrasound, and then they compare it after the baby's
Because you
born.
got to see little feet and toes if such thing
Yeah,
exists, right?
yeah.
I'm not a grandfather. I turn 57 next month. My son and his wife, if they make babies, God bless them. I guess I'll have to. But I would be the guy if we were even social friends saying, "Doc, I'm grandfather. What do I need to know about the next 9 months with my daughter-in-law, which I do have a
Yeah,
daughter-in-law?"
yeah.
So if they come to me and say, "All right, we just got word, things are we're gonna have blue balloons or pink balloons, we're gonna do all that stuff," that I think excited parents might. My son and his wife would be very excited parents. I, I don't I don't know that I'd be the excited grandparent. I'd be the nervous grandparent. A modern pregnancy, how does this go? You think you're pregnant, you know you're pregnant. Now they come home and they tell Grandpa Ness,
Mhm.
let me take a second on that. I have to like, whew, okay, I got the colonoscopy for this GBMC thing's gonna wear me out. So, with the possibility, I like my lottery promotion where I think about living in Walea more. But so the thought of being a grandparent for me would be the thought of, okay, let's make a healthy baby. First things first. Now, this is where Coach Nestor comes in and says, let's, cheerlead my daughter-in-law Aubrey. Okay, we're making a baby. What do we? So, how often would she see you? What is that period of time where we can all get excited if such a miracle happens?
Yeah. So usually for a routine pregnancy, I see them every 4 weeks until 28 weeks, every 2 weeks until 36 weeks, and then every week until they have the delivery. So the full term is 37 to 39 weeks, and 40 weeks is the entire pregnancy.
I
And
love
so
routine, by the way. You said routine. That's what we want. We want a routine pregnancy, right?
exactly.
All right.
Yep. Yes.
Good
Yes.
word. I like that.
Yes, exactly, exactly. I mean, pregnancy is routine, right? It's the circle of life. It's a very natural phenomenon, but during that whole natural phenomenon, things can go wrong, and that's why we're here. We're just, here to make sure that all the crazy things, if they happen, we're still able to navigate the mom and the baby safely. But it's a really good question that you're asking is how grandparents or partners can really support the woman because when someone becomes pregnant, they are going through a whole lot of changes. Like for the grandparents, yes, you are nervous, you're excited. Same thing with the dads. They're like, "Oh my God, I don't know. I have to like make the nursery." They have all these like, the first thing is excitement, and then comes the nervousness of like all the things that we
But
need to
I
do
don't
for
have
this
the
baby.
hormone issue. I
Yes,
don't have to deliver the
exactly.
baby. I don't have to do all I have to
Exactly.
do is just be here and hang out, I think, but I'm trying to be
Exactly.
educated.
Exactly. And so a lot of times moms don't do very well with all of those changes, but they're just trying to keep a straight, they don't like I think in the modern society now, a lot of women are working. A lot of women with social media also have this pressure of just like bouncing back and showing that everything is normal and everything is great. And a lot of times when patients come to me, there is nobody else that they complain to. I am the only person that they come and they're like, I am in so much pain or I just feel so tired all the time and it's just that constant pressure of being like I'm okay, I'm great, this is an easy pregnancy, and somehow we're in that society what makes it, we look at a pregnant woman and we're like wow, you're looking great, like and everyone wants to hear that. And so I think having at least one venture where the woman can just be like, you know what, actually, like today I just feel really tired and it's really heavy and walking hurts and sometimes just you can't lay down how you want to lay
I
down.
remember the Ritz crackers in the morning. I remember all of that. Yeah.
Exactly, exactly. Not being able to eat what you really want to, or just some smells that you used to really love. And now you're like, I can't sit next to anyone who's eating steak. Like all these things that you just can't control. And your body is going through changes which you can't control. And so, having like the support people understanding them and kind of bringing the temperature down of that pressures, kind of being like, it's okay for you to not feel great. It's okay to just come out and say pregnancy is not always like the coolest, the best thing ever. Sometimes you just feel really icky during pregnancy, and it's okay to share that because that helps with accepting those feelings and also doing much better in terms of peripartum anxiety or depression.
Well, I would also say, by the way, Aneesha Varrey, Dr. Aneesha Varrey is here. You can find her over at GBMC. You can find our partners at gbmc.org for all of this stuff. I have found them. My phone is rang. I'm making appointments. I will be reporting back. I will not be showing any of my ultrasounds on my social media, but I will be reporting back that all of these years of talking to people about health, I'm now like acting on it. So
That's amazing.
I mean, I'm being accountable. It's terrible to have to do this in my sixth decade, on the plan to be accountable to all of this stuff. You said something about it, being sort of an adventure for the people on the outside and how they can be supportive emotionally and maybe just to understand more about anything that this is going through. But what is the best advice that you get? What's just simple advice about staying off feet, just simple things like that. Because every time I see a really pregnant woman, there's two things I know. They're like, I can't wait for this to be over with,
Yes.
usually at the end, and especially if it's in
Yes.
June, July, and August for sure. I
Yes.
was an October baby, so I got you. But I think the other thing is you're like, I want to hug you. I want to help you. I want to get you a cane. I want to get you a seat. Can I sit you down? Do you need some water? That they get treated as though they're in need the whole time. And it's like
Yes.
sometimes that can be a little bit too much. So just how to handle it from my perspective, but what they should be doing, what's universal good advice for anyone who's pregnant. Obviously the smoking, the drinking, the rest, all of those basic things. But is there any newfangled advice that I wouldn't get on AI?
No, you're absolutely right. Just trying to help the pregnant woman, because especially towards the end, it gets hard to walk, it gets hard to bend. So just being there to like, let them sit or not to stand too long, or make sure they're hydrated, make sure they're eating, they don't have to eat a big meal. Don't force them all the time because their hormones are also like, so you don't want to keep annoying them about little things, but just always make sure they're
I'm
resting,
a
that they're
husband. I'm really good
hydrating.
at annoying about little things, right?
Exactly, I know. All
Right?
husbands are. But I think just, helping out with a lot of the house things, like, doing the dishes or cooking, or not having that pressure of all these other extra responsibilities. If you have another child, really like taking over their bedtime or helping with those chores, or even surprising them with like 200 micrograms of caffeine is totally safe for pregnancy per day. And so, if they need a little nice coffee or something to like make them happy, or something they really like, I think that universally all pregnant women, they just need more help, because once you deliver the baby, it is like I mean, it's a new baby, the baby can't talk, you can't control what the baby's feeling. Baby's crying, the mom is trying to breastfeed. There are so many changes that are happening. So anyone who can come home, help them with the chores, say, you why don't you, and at least get like 30 minutes of sunlight, go outside, walk for a little bit, so you have some, like, remembrance of what kind of a person you were before you became a mom, and you're just like diapers and breastfeeding and baby and things like that.
Well, I have this funny sitcom in my mind of my daughter-in-law being pregnant, me just you know, burrowing in and say, I'm doing the dishes. I'm doing everything for you.
Oh,
And
that's
thinking about,
great.
no, that I don't think that would go well in this sitcom. I'm not sure about that. Dr. Aneesha Varrey is here from GBMC. We try to have a laugh along with our education here. I think the other part is I looked you up before we come on, and some certain things I don't know enough about, like colonoscopies, and other things I know a little bit about as being a parent and remembering morning sickness with my son's mother many 41 years ago now, so it's been a minute. This week is he'll be 41 this week. So when he hears this, but I
Wow.
saw the word perinatal, and I thought to myself, like, I hear so much about postpartum issues, and not just the issues of women going back to work in the modern workplace and
Mhm.
jobs and all the stresses that kind of come with that, and the expectations and earning, and then and having other children. And I mean I I had someone on this week that had 5 children, and I'm like, that's just sounds really one. We're talking about one here right now, Doc, and I'm sitting back saying, all right, how would I, so then you start to add that up, but then the part for women that is, to your point, hormones crazy. My wife's a two-time cancer survivor. She's had two
Wow.
bone marrow transplants. I've watched all of that happen at the same time, where menopause, perimenopause were brought on by a needle, by a doctor when she had cancer. So I've
Wow.
seen all of this, but I've read and heard. I watch enough, starting with Donahue and all the way through Oprah, and for 50 years, just about problems post pregnancy, how much different a woman's body is. And I learned this, incidentally. My wife was we when she was battling, we went and got swabs for the bone marrow registry. We learned that in science they will take a male donor. Her donor was male because women who have had children have different compromised and immune
Yes.
system issues that don't make them ideal donors in that situation. So I've learned all of this as I've gotten older, but I think that would be my number one concern for my daughter-in-law is the minute this baby is born, make sure you can get normalized and get the care
Exactly.
and the help you need. I don't think my wife got enough post trauma care after her cancer that I'm
Yeah.
thinking that this giving birth, as much as it's natural, it's traumatic.
Yes, yes. And I think that's another part of modern medicine, which I think is wonderful, is yes, as you said, we doctors, as doctors, we go to medical school, we're all about the medicine, we're all about the science. We're like, what can we do? What can we, how can we make it better? And I think there's a huge role for the emotional part of it, like you said, post-trauma care or even post-pregnancy care, right? So delivery is a very normal process, but women after delivery, like the minute they leave the hospital and go home with this new baby, and now they're like, oh my gosh. Like one patient came and told me, she was like, Doc, I just feel like I'm always leaking. Like I'm leaking from, breastfeeding. I'm like, I just delivered, so I'm leaking. Like, and they just feel like so like they are not sleeping at night and they get 1 or 2 hours of sleep. Everything is fragmented. They don't know what time, what day they're in. It's
I think
like,
if anybody spends 20 minutes just with an infant on their lap, just a small infant on their lap, they realize, wow, this
mhm.
doesn't take a minute off. And if you haven't
Yes.
done it in a long time, and I
Yes,
haven't, the amount of respect that you have for it, but also just the notion that you have care now and that we're thinking about these things in
exactly.
terms of Fred and Wilma sending, Pebbles home and saying it's all over with, go home, take care of the baby, and good luck.
Yes.
I know you do a lot more than that these days at GBMC.
Yes, and we have a very good collaborative care for any woman who's like, I don't have a lot of support. GBMC also has doulas that in postpartum doulas. So
What is
if
that?
yeah, that's an amazing service. It's if you so we have doulas that'll come to their house. So if I got pregnant and I delivered, if I book them like, early in the pregnancy, they'll come to my house for like 1 or 2 weeks. We can choose the hours. They come and kind of help out with the entire house, make sure all the bottles are cleaned, everything, help with the breastfeeding, help the mom really just be there for doing baby laundry, just like really being that support person if the mom is like feeling inadequate because she can't produce enough breast milk. They're very good at lactation. So you just have like this one best friend who is in your house who's like, you can do this.
Man,
Let me
first
show you how
couple
to
weeks is
breastfeed.
so important, right?
Yes, yes, it is. It is an amazing service that GBMC offers. We also have something called collaborative care consults that we place for women who are like, I am struggling, and my husband has to go to work. My parents live in a different state. I have no help, and I'm just like, I can barely hold on. We always encourage them to reach out to us because GBMC has so many services that we can provide. And we have like a group of therapists, a group of postpartum doulas, and all of us kind of, we have a community that we can kind of in the world of AI and social and, reducing distances between people getting care, we employ a group of people to go there and help, help this mom in certain places where we, she could have gotten help from our family. So I think, as a community, GBMC is really dedicated to moms who are struggling with babies, pregnancy, postpartum care, not just mom, even partners, families that are struggling. Like if you don't have all of your family members here and it's just dad, mom, and baby, and now the work culture is like, you need to get to work ASAP. Like you need now to find someone to take care of your baby, or what daycares are good, or trying to get capital for daycares. There's just the number of problems with children, let me tell you. They just start,
I went to
building.
Disney World a couple months ago. I saw it. I did one day at a pool with kids a couple weeks ago. It worked out.
Yeah.
Dr. Aneesha Varrey is here. She's with GBMC. So the last thing, because I began this by talking about my friend who was a nurse at GBMC many years, 3, 4 decades, maybe the 80s, early 90s. And preemie babies is, a word that I don't know how we say that at this point, but I would think that problems in pregnancy get identified very early in treatments, in education, and information, and science, and knowing we have a problem, how to handle that problem, traumatic early delivery that can't, everything's routine until it's not, right? In month 6, month 7, something happens.
Yes.
So in that case, tell me we're saving more babies' lives than maybe we did when you went to med school. I'm sure that was just
Yes.
a couple days ago too.
Oh, I
Um,
hope so. No, many years
yeah,
ago.
yeah, but just how far it's come that when someone in, you know, middle last segment of has a problem that that it can be better solved and better cared for than maybe it was when my mom had a problem pregnancy in the 1950s.
Oh, 100%. Yes. In fact, I was just reading a book about the presidents. And, when you read through all of the presidents, these are people who are, you say the cream of the society, and they still had so many children who died during childbirth, and their partners who died during childbirth. So this was, I mean, from just going back to a few years ago to now, more women are surviving if we diagnose anything early. It's the most important thing, as you said, now we have women are have so many resources. So like we have apps. GBMC has a really nice app that we encourage all pregnant women at the intake visit to download, which kind of keeps giving you're in week 5, you're in week 6, or you're in week 27. Make sure you look out for preeclampsia. These are the signs. So when they do have those signs, they know to come into the hospital. Once we diagnose it, I mean, there is still, at the end of the day, a lot of things that we can't do to like stop because stop any disease that's going on or something that is getting worse with the baby. We have to deliver, and we have preemie babies, but those preemie babies or premature babies that actually do well, the numbers are really high. So now a baby being born at 28 weeks, I always tell my patients, this is not a baby that you see playing in the park when they're 3 years old and you're like, that baby was born at 28 weeks. You just can't tell. That's how great medical care has advanced. We probably can't stop preterm delivery as much as we could. I mean, as much as we want to, but better than what we could in the past. But the babies are also doing much better if they're born early.
All right, so I got a neighbor that's really pregnant, and I'm rooting for. I just yelled at her husband out in the street. I'm like, October 14th, that's my birthday, and he said to me, he's like, well, she's due on the 7th, but on the 14th they're coming for it, and I'm like, all right, so if it goes full term, I'm gonna get a. So I am cheering for a neighbor. It's good,
Yeah.
I
Yeah,
think I've over the
absolutely.
last 15 minutes, I think I've become more educated that I can at least have modern verbiage, even though you frightened me, inspired me. You've done it all here in 20 minutes here as a
I hope
Grandpa
it's more
Ness.
inspiring.
Oh man, if Grandpa Ness on the radio would be its own sitcom, I promise you that if that were to happen. My friends at GBMC Healthcare do more than just deliver babies. I talk about it all the time. They've delivered me an appointment for my colonoscopy, and I'll be talking about that. We had Dr. Ascari on last week. You can find that at Baltimore Positive. Dr. Varrey, you have been dismissed. My appreciation for all of your education and making me just a little bit smarter, just in case it happens in my family, but it's already happened to my neighbors. And hopefully, if it happens in your family, you get the good care over GBMC. Thanks, Doc. Appreciate you today.
Thank you so much for having me. Have a good day.
Dr. Aneesha Varrey joining us here from GBMC. They sponsor our hotline as well as our injury report. Luke is out in Owings Mills right now. We're getting ready for football. It is the fall season, and we're having some fun around here as we're getting educated as well. I am Nestor. We are WNST, AM 1570, Towson, Baltimore, and we never stop talking. Baltimore Positive.